Today we're going to be talking about media use and obesity. And the purpose of this talk is to help you as a provider understand the relationships between media use and obesity for our pediatric patients. So starting this talk, it's probably useful to start with thinking about what kind of media use we're going to be discussing. For the purposes of our talk today, we're going to be discussing media use that's related to entertainment. So when our patients are researching something on the web for a class or engaging in academic media use, we're not talking about that. We're talking about entertainment. So it's helpful to think about two types of media use. The first is traditional media use. This would include television, movies, even the radio. In this type of media use, a message is created by a corporation and comes out in a unidirectional way to you as the viewer. This type of media use is very popular among our pediatric patients. In fact, it's estimated that by age 2, children will have spent more time watching television than reading books. And the average age at which children begin to watch television is now estimated to be approximately 4 months old. So this is an incredibly common type of media use for our pediatric patients. The second type of media use is social or interactive media use. And this media use has really grown in the last 5 to 10 years with Web 2.0, because Web 2.0 allowed us to interact with the computer, not only to view content, but to create it ourselves. And so social media allows our pediatric patients to be not only consumers of media, but creators of it. And this type of media use is incredibly popular among our adolescent patients. In the US, it's estimated that somewhere between 75 and 90% of adolescents engage in social networking sites, such as Facebook. So social media use can include social networking sites. It can include online gaming, where there's an interactive component. This, as an example, you could have an 8-year-old boy in England who's playing World of Warcraft in real time with a 12-year-old boy from Taiwan. These are incredibly interactive experiences, and our teens love them. These experiences with social media are also starting to happen younger and younger. Recently, it was estimated that about half of children between the ages of 0 and 8 have access to a mobile device like an iPad or a smartphone, where they can start to learn to interact with these social media types of applications.